Hello, ladies and gentlemen. Welcome to All India Radio Houston. I am Dr. Nik Nikam. I want to talk to you about pericarditis, or inflammation of the sheath that covers the heart. In order to do that, let's pull up some picture from the website. To do that, I have to go to my screen share function. I want to pull up an image of the web page, and here I want to click. Let's go back to screen share. Okay, I want to be able to share the desktop. That's what I want to do. Here, I'm going to share the desktop. So I'm going to pull up a new page, new window in the website, and I'm going to bring up a picture of a heart. This is not the picture of the heart I would like to. I would like to get a pericardium. Pericardium. I want to go to Google Images. Let's look at and see if we can find a nice image here. Oh, here's a beautiful picture. Let's select this one. Let's open this in a new window. Okay, here is a picture of a heart, and there is a white sac that surrounds the heart. This white, thin tissue paper-like tissue is called the pericardium. Peri means around, cardium means heart. A sheath that is around the heart is called the pericardium. It is a very thin layer of tissue that surrounds the heart, and there's a thin layer of fluid between the heart muscle and the pericardium. The interesting thing is the pericardium acts like a cushion for a beating heart. When the beating heart rubs against surrounding structures, it can cause friction and wear and tear. But the pericardium, with a thin layer of fluid around the heart, prevents the heart muscle from wearing with each heartbeat. In addition, the fluid around the heart also acts like a shock absorber, which absorbs the impact of injury. So occasionally, this pericardium can get inflamed, which results in pericarditis or inflammation of the sheath that covers the heart. That can cause chest pain, palpitations, and flu-like symptoms. This is very similar to pleurisy, which basically affects the lung covering. And this also is aggravated by sharp movements. And pericarditis is diagnosed most of the time with the typical presentation of chest pain, which gets worse with movements or stooping forward, and by characteristic electrocardiographic changes. When a patient is presented with a history of pericarditis and findings consistent with pericarditis, generally they are observed in the hospital for 1 to 2 days. They are treated with anti-inflammatory agents such as indomethacin or Advil, and most of the time pericarditis is a self-limiting disease. Generally, pericarditis is caused by a virus, and there is no specific treatment as far as antibiotics are concerned. Pericarditis spontaneously resolves over a period of 3 to 7 days, and occasionally it can recur because it is a viral infection. But for the most part, it does not cause any permanent heart damage. Occasionally, we can see elevation in the cardiac enzymes suggesting damage to the superficial myocardial fibers during the inflammatory process. So this is a brief description of pericardium, its function, and pericarditis. In patients with kidney failure, sometimes the pericardium gets chronically inflamed, it thickens, and it begins to accumulate large quantities of fluid. When a pericardial sac is filled with a large amount of fluid, it is known as a pericardial tamponade, or it is choking the heart. Because the pericardium cannot expand acutely, the fluid accumulated between the heart and the pericardium compresses the heart, it chokes the heart. As a result, the heart is not able to pump efficiently. That can result in a serious medical emergency. Pericarditis, as I told you, is a benign condition and is generally self-limiting. Thank you for your attention. Okay, let's get back to the menu, the screen sharing. Take it out. I am back. So, ladies and gentlemen, I am Dr. Nik Nikam. You are listening to All India Radio Houston, and we were talking about the pericarditis. Next time, we'll talk about another topic. Thank you.